Welcome back to our unique project, the InnerView with Chiluveru, where we showcase people with unique ideas, bright accomplishments, as well as good deeds. My name is Viju Chiluveru. I'll be your host for this show. We are taping this at our studios in Atlanta, United States. We bring these videos closer to the community so that many can benefit, especially the younger generation can set these people as their role models. Today we have with us Dr. Sujatha Reddy, a psychiatrist who lives outside Atlanta in Macon City. She loves community work and she strongly believes that everyone should have equal opportunity to this medical, to the health care. So with this in view, she started Sai Health Fair in 2001, and the very first such fair was organized in 2002 with grand success. She motivates doctors, volunteers, nurses, and also sponsors to make this a success. So let me turn over the camera to Dr. Reddy to learn more about this project. Dr. Reddy, welcome to the show and thank you for accepting to interview with me. Can you please explain to me what motivated you to get into this community service, which involves so much of work? You need to coordinate with so many different people, so many different parties. So please explain to me. I was a part of your first project in 2002. I was a volunteer. Even my wife was there. Sandhya was also there too. And I was so blessed, and I was so happy to be a part of this community because I've seen so many people getting benefited. So many doctors were there. It was such a happy moment for me. So I would like to hear from you how you've been doing since then.
This, my professional life as a doctor, my mother was my big support, who wanted me to become a doctor since my childhood. She's in spite of my father's objection. And in the 60s, they don't want to send the ladies to the college. And but always my mother was a devotee of the Baba.
Sai Baba?
Sai Baba.
Okay.
So she was always used to tell me, Baba is going to guide you and you will become a doctor one day. And whenever there is exam, and she always made me to do the vratam. And that way I inspired that I was continue to have positive attitude to become a doctor. Then I got the seat at the Sri Padmavati College, Tirupati, where I was intensified my charity workup. So the first time I was become there in the hostel as a puja committee chairperson to handle the staff. They have, the students to get up early morning to do the suprabhatam before they go for the breakfast. And where I developed more charity views in my mind. And then after finishing my college, then I got the seat, medical school. And then again, my father doesn't want me to go to the medical school because going medical school again, giving the dowry system. My brother sneaked out and then applied, and I got into Kannur Medical College, where I got the scholarship. So when I get the scholarship, my father doesn't have to pay. So then he agreed for me to go to the medical school. So I finished. While I was in the medical school, I was very active in sports. For 5 years, I was a champion in field events, and I was a tennis champion at Venkateswara University, and also field events. And when I was continued to, and also in the hostel, I was a ladies representative. And final fourth time I became a champion of that. And the principal of the college, he asked me to stay away, give the opportunity for somebody, not to participate. So I stepped aside. So then finished. Then I started this internship, house surgeons. In the house surgeons, I became a ladies representative.
Which is like a residency here. We have
the internship, yes. Okay. So I was a ladies representative at that time. Then after finishing, then I applied for postgraduate training in OBGYN for Hyderabad. So I graduated in 1971 and I came and joined OBGYN in Nilofer Hospital, Hyderabad. When I finished 1973, and my uncle and told there is an alliance coming from States. So Mohan Reddy was there looking for alliance, and one of my uncle's son-in-law, friend of Mohan. So he told about this alliance, and within 1 month, everything is, they inquire about their family, my family inquired. And that's very quickly happened, and got married. I came to this United States October 1973. After I came here, and then my husband is an electrical engineer. So then I took the flex exam, and Georgia flex exam. Then without going to the residency.
To go to, I think to practice here, you need to
the flex exam, license exam.
That's right, yes.
So then, usually they take that license exam after finishing the residency.
Correct.
Here, I went and I took it. Then there was a rule at that time. Now they're not allowing like that. So I went and took that 3 parts. So I passed it. Then I entered into the residency in Norwich State Hospital. From there I came to the Birmingham, Alabama. So where I finished my residency in psychiatry. The reason I took the psychiatry because of I have to think about the raising the children.
You're an OB-GYN, you said. That's what you
Yes.
said earlier in
India.
Yeah, but when you came here, you took up psychiatry.
I applied for that, and then I heard about the OBGYN and all these is too much, malpractice, even all these.
Oh, okay.
So it is raising the family.
Understood.
It is very tough and all this, and I decided to go into the psychiatry.
Okay.
With the guards, and then I praying the God and Baba, and please guide me whichever is the best, and I would like to take it.
Yeah.
Then I applied this, and I got into psychiatry residency. So then I finished a psychiatry residency in the Birmingham, Alabama, and then became before that I was pregnant with sham.
Yeah. Older son.
And then it is very hard, and my husband was here and in Birmingham, and I was 1 year in Norwich State Hospital. Then I have to move, and he was taken care of, and it is too much.
Correct.
So then I got into the transfer to Birmingham, Alabama. After finishing, then moved to Georgia. So
which year was that?
Huh?
Which year was that?
Moving to Georgia, 1982.
So 82, now I think it's about 34 years. You've been
So
in
yes,
Okay.
and then first came to Dublin, where I got the state mental health.
Further to Macon Institute.
Yes.
Right.
Then Dublin, Georgia.
Dublin.
Then from Dublin, Georgia, I took in Macon.
Okay.
But now actually I live in Jonesboro,
Mm.
and 4 days a week I work at the
So
Macon.
you're coming closer to Atlanta City, I think every few years. Dublin, Macon, Jonesboro,
Yeah.
right?
So Jonesboro is the actual residence there. So in Macon there is the condo there. And then I go Monday morning and come back on Thursday evening
Okay.
because I work still for it. The reason I'm still working, before that I was in maybe couple of years in private practice, but I didn't, it's not, but this way I've been able to help more poor people, no insurance. The state mental health clinic is funded by the state and federal and county. A lot of people are poor folks and no insurance. And when I started doing the Macon mental health clinic, I started some indigent program. Before that, it was not a medical model. I started medical model means most of the mental health clinics in this country, they don't even give psychiatrists antibiotics. They don't even do the blood work, complete blood work. I started.
Which is necessary to to diagnose what the problem is.
Yeah,
Okay.
but every new patient, when they come in, I told we need to have a complete blood workup. And also the complete blood workup, if there is anything is abnormal,
Correct.
then we will refer to the other doctors. some of the basic things, some anemia and simple urinary tract infection, I take care of it. From other doctors, they don't take it, but I usually do. If I want to refer to some other doctor, they don't have insurance. So you can do that. I have a very simple anemia. I take care of, you need just ferrous sulfate, urinary tract infection, only this Septra, Bactrim, you can, that is a routine thing.
Correct.
You don't have to refer. If the blood workup is like glucose, maybe 500, then I refer to the endocrine. Otherwise, I take care of them. So which helped me so much. And the indigent program, what I started, those who cannot afford, the medicines are so expensive, they cannot afford. I'll give you some examples, some of the shots. You give once a month, that shots are $1,700.
$1,700 one shot.
One shot,
Oh my God.
once a month. So to keep the patients away from the hospital,
You cannot
and
afford.
also I cannot afford. And the PO medicines by mouth, they won't take, the psychiatric patient. And also some shots, $800 to $1,700. And once a month. And the pills also, some of the pills, some Ziprexa, and these are $800 or something like that. So I developed an indigent program. I used to get the samples from the coupons and samples from the companies.
Right.
So when I write, they cannot tell me, you can't write that medicine because it's very expensive. They
Right.
don't get funds.
Correct.
They get funds only $350,000. How they can,
Afford
so
all
they
this.
will tell don't write that medicine because of that. So I developed indigent program so that I used to get like company, Pfizer, they used to give. So when they give the coupons, then they will take to our pharmacy. We have an internal pharmacy. So that pharmacy, they will deliver that medicine, send that coupon to the company. They are making actually over 18 million, close to even $20 million actually I raised. Temple made the money.
Which means you have worked with the pharmaceutical companies to subsidize or sort of give out some free samples to the people who cannot afford.
Samples we don't charge.
Right.
Coupons they will go.
So it's
The
just
coupons-
subsidized. It's just
Yeah. So coupons, if they take it outside, the pharmacy will make. Outside
So
pharmacy.
is this a sort of a starting point for you to think of this Sai Health Fair?
Yeah.
Can we say that?
Yes.
So that's how you're building the
Yes,
story now.
building. So then, because I always wanted to do free, because that's why I always wanted to work in the indigent clinics,
Correct.
state clinics.
Mhm.
So this one you can help, like sometimes patients, they will demand and I show them Mother Teresa picture, look at that. So you cannot demand, I'm trying to help and I'm trying, if your soul is a fraction of God, I'm trying to Miss Richard, I'm trying to treat you in your soul, but not Richard. So that was make me happy when I go home and I have to sleep. So these medicines, the coupons, not samples, samples will be given free,
Right.
but only coupons. That is illegal. Any pharmacy can send and get. So actually, clinic made the millions of that. So that is where we did. Now last 3 years, with Obamacare, they can't give not even one pill, one sample, or any pill.
I think they made it stricter.
Okay, stricter.
Right.
So, but still they give some coupons now. When they give the coupons 1 month supply free, I can ask my pharmacist to give 1 week supply free. Then they will take the coupon and my pharmacy can fill it up and they can fill it up outside. The back to shots, which still we are getting indigent program, we are continuing. And those shots, it helps a lot to keep the patients away from the hospital, save the taxpayers' money.
Correct.
Otherwise, these people will be keep going. It's amazing that still it is very expensive. Now the latest shots came, every 3 months you can give.
So there's
It's a
lot of-
higher dose.
a lot of-
And every 3 months, they're giving free those who cannot afford. But if the medicine, if the companies, if they have, if they have an insurance or a Medicare and Medicaid, I have to try 2 medicines
Totally.
first before it is approved. That our nurse was trained how to manipulate, how to get it approved.
Sure.
Some of the patients, most of the patients, they are already 2 or 3 medicines already.
Correct.
So this way, it makes me happy to continue to serve this population. That's where I get the energetic. So when I go home, even if I don't explain or do that,
Sure.
I get my check. But that is not going to make me happy.
Yeah, so your job is not giving you all that satisfaction unless you go to the community, touch their lives. That's what your goal is. Okay, definitely our viewers are eager to understand more about this health fair. Let's focus on that first. So you started in 2002, and I guess I said I read in the on the website there are about 35 such health fairs done. Almost about 10,000 people were benefited, and 990 doctors served. There's so many different volunteers and all. So please explain to me how difficult it is for you to coordinate with all these people, and tell me some of the challenges too, so that I think more and more people from the community may come forward and try and make this more successful.
This is it takes a lot of time. One day, how it started actually. One day, it bothered by the lack of health insurance that many Indian immigrants were facing, inspired me by inner voice. One day, suddenly, and started Sai Health Fair, and that is 2002. Sai Health means see always inside. Selflessness and awareness, integrity with embodiment of truth.
So having the spiritual thinking in the back of your mind definitely helps you keep going, right? It gives you a lot of strength, I guess.
Yeah, and also service is service, the humanity is serving God.
Correct.
That was my guiding mantra. That guiding mantra, which since every soul is a fraction of God, that was my main mantra. And that kept in my thing. And these health fairs, and also I connected with Mahatma Gandhi. Because health fairs as a tribute to the life and legacy of Mahatma Gandhi, and also promote his and Dr. Martin Luther King's philosophies of nonviolence, community service, and social justice. And this Sai Health Fair is trying to respond to help all those poor and needy who either does not have a health insurance and cannot afford quality of health care, and also arranges preventive medicine for education and diabetes, smoking, and physical fitness, hypertension, and nutrition. And what it makes, this is, it is endless. It is not that easy. It needs a lot of dedication, commitment.
There's so much more to do. There's so much more to do.
Yeah, I start 3 months ago. 3 months before.
3 months ahead of it.
Ahead of it.
There's so much planning.
Then I will talk one time, call the doctors. I'm going to have a date. This is the date, please mark in your
You call them personally?
Huh?
All the doctors?
No, I call them.
You personally?
No, I
you
call
put it the phone.
Yeah, no emails, nothing. I call personally. I'm going to do the health fair in your area.
Right.
I want you to help me. Can you come and make a calendar? Okay, I will call you and let you know. So these 3 months, they're not on call. Then I will ask them to put. Then when it comes 2 months, are you still there? I'm going to have a health.
So you don't finalize a date. First you try to...
No, I finalize the date.
Okay.
I put the date. This is the date.
Okay.
Always it will be Saturday.
Okay.
So I put them and 7:30 like that. I want you to come and give few hours of your time. Donate. This is the way I talk to them.
The word
Please
is
donate couple of hours, your time, to the community. What then if they say a little bit negative? Let me see, I will tell you what Kennedy said, what you can do for the country, what you can do for the our community and society. Then if they say a little bit, you are already making a lot of money, then I put that guilt into them. Then they don't have other choice. Okay, I will come maybe 1 hour. This specialist like cardiac, which is orthopedic, ENT specialist, dermatology. This is the biggest.
Dr. Reddy, I would like to ask you some questions focused on this Sai Health Fair. So my very first question will be, where do you get the funds for this fair? Like it costs at least about $10,000-$20,000, I guess. So do you get money or do you have sponsors?
Sometimes they will give the sponsors, and sometimes I put up my own money. Yes.
Okay. Now coming to the doctors are always busy, they're on call. So when you do this on a Saturday, how difficult it is to find doctors to organize these fairs?
I don't think so I will have any problem if I inform them way ahead of time and schedule, they will come.
So it's very well planned. So
Yes.
you plan it maybe a few months ahead, call them.
2 months ahead, and I will follow up, and that was not a problem for me to get the doctors.
Now coming to the volunteers, I guess there are at least 300 different volunteers, but they may not come for every fair. So maybe there are 50 volunteers in a health fair. Just supposing, like assuming.
Mhm.
So who are these people? Do they have to be necessarily from the medical field, or anybody can come and help you?
Anybody, they will call themselves, they wanted to come and
Okay.
wanted to volunteer
Okay.
for the sake of certificates, and that they will volunteer at the health fair. But I don't have to look, and lot of people I have to decline to make them to come.
Why is that so?
Because
Suppose
there's so many people, I don't want more
Oh, okay.
volunteers than the participants.
So you're saying there's so much demand for the volunteering, so it's overflowing. Like you don't
Yeah.
need so many people. Okay. Now coming to these pharmaceutical companies helping you were mentioning earlier that they give you a lot of supplies. Sometimes they sponsor something. So are they repetitive people? Do you have somebody, some people on the list? For example, Pfizer.
Mainly Pfizer and Eli Lilly,
Okay.
most of the time.
These people send you some supplies, some.
Used to do that,
Okay.
but not anymore, since the Obamacare came last 3-4 years.
So let me ask you this question: like, how did this Obamacare affect a general person? Let's talk about a person who. We'll talk about middle class person first. Let's not talk about the person who is not having health insurance or very rich person. Let's say a common man. What kind of effect or what kind of impact this has had?
It will be very big impact on them because of the premiums are very high compared to the previous,
True.
and the healthcare problem in chronic diseases in the public is very high,
Hmm?
and they were not able to meet due to these restrictions of the Obamacare, and he thought that it will work, and due to the young generation will sign up. Young generation is not signing up, so it is going to be very expensive. Some of the major insurance companies are leaving. With January onwards, United Healthcare is leaving,
Oh no.
and they're going to increase the premium.
Once again?
Yes,
Oh my God.
it is going to be increased from January onwards. Some of the other companies also might leave. So it is going to be really difficult.
For me, I think I'm paying 60% more than what I paid earlier. Okay. Now coming to the elections are in November this year. So the Republican side, they keep saying that they would like to repeal and sort of see that it ends here. So do you anticipate?
I don't think so. It is not that easy to repeal that. It is already in the process. They might tell, but this is very, very difficult. It will move forward,
Okay.
I think.
Now, in case I would like to participate as a patient, what should I do? Can you tell our viewers what exactly they need to do if they need to participate in this?
About the health fairs?
Yes.
Yeah. I request, the people, more participants, and I call it the participants. I encourage them to come and take advantage of these health fairs and get their health checked at least once a year, and make sure that their health is in a good shape. And by doing the blood workup and having the consultants, free consultation, it is a blessing from the God. Without appointment, seeing about 3 or 4 consultants, that is a blessing for them. And I want them to come and take advantage of this health fair. Once a year, blood workup needs to be repeated. And also, once a year, if there is any history of cancer in the family, get that colonoscope once in 5 years. and females mammogram every year, and the female organ that pap smear should be every year. There are some preventive tests out there. I strongly encourage that information will be given at the Sai Health Fairs, and will be very beneficial. And in the future, I'm planning to have even have a table to set up there for mammograms to get the appointment. Then they can go to the hospitals, have the mammogram done.
Okay. So the website is www.saihealthfair.org.
.org.
You can go there and inquire or register for the next health fair. Thank you very much, Dr. Reddy, for sharing your thoughts and explaining all about this health fair. And thank you very much once again.
Thank you very much for having me to have this interview.
Our pleasure. It is definitely useful for our viewers. So thank you very much for doing this.